to Aesthetic TV. I'm Stuart Brazel. Right now we're at the Aesthetic TV treatment area, and we're going to actually show you on camera a volumizer injected into our patient, Terry. I'm joined by our nurse practitioner, Pam, and Dr. Werschler. Now, Terry, I understand that you feel that your face is thinning and you want to get that youthful look again. Is that right?
Absolutely, 100%. I'm 44 now, and I feel like I just need I'm a little too thin. I want to give it to the youthful again, so.
Well, luckily you are in very good hands. I'm going to toss this over to Dr. Werschler.
Terry, I want to talk a little bit to our audience about some of the structure and the anatomical features of your face, okay? If I sound a little clinical, just bear with me. One of the things I notice about you look like an endurance athlete. We were talking earlier, and you like to play soccer. And there's a lot of running and a lot of calorie burning in soccer. And as you lose weight on your body, your face also deflates. And aging doesn't help. You're a young guy, but still you begin to age and you lose that volume. What I've noticed on you, Terry, are a couple of areas in particular where I think the air is going out of the balloon and where we could reinflate a little bit, and I think that may address your concerns, okay? What I'm going to do, if it's all right with you, I'm just gonna make few little marks on your face, and I'm gonna have you just go ahead and rest your head back and maybe turn just a little bit like that. Perfect. One of the things that we see is in the temporal area, you have a real hollowing in here. And we call that a temporal hollowing or bitemporal hollowing. It's a volume loss. And we can put some filler in there, reinflate that area, re-volumize that area, and I think you'll find that particularly pleasing. The other thing that I notice, you look like you're pretty muscular. You have a very well-developed muscle here. This is our masseter muscle. That's what we chew with. And that gives you a real nice jawline definition. But in front of that and a little bit below your cheekbone in here, you also have some volume loss. So I'm going to put a couple little marks right through here and right through here, where I see, again, a little bit of volume augmentation would help to balance your face out some, okay? So that's our treatment plan for today. We're going to be using a product, it's one of my favorite products. It's called Radiesse. And Radiesse is actually two products in one. One of the products provides immediate volume restoration, and the other product actually stimulates your own collagen-making cells called fibroblasts to make your own new collagen, which is that structural protein in your skin. It's the 2x4s that provide the support. That takes time to develop because you're growing new collagen. The other part of the product is going to provide you with immediate volumization today, and that will slowly dissipate in the coming months as you grow new collagen. It's a very balanced approach. It will volumize you, and you know the best thing, Terry? It's long lasting.
Yes.
Okay. Well, maybe what I'll do is I'll just step out of the way and let Pam come in, and she's going to go ahead and get started with the injections. Before we get started, do you have any questions?
No, I think you answered everything.
Okay, great.
Okay, Terry, I'm going to start right up here in your temple, and you're going to feel a little pinch. Little pinch. In I go.
How's that feel so far, Terry?
I barely feel anything, to be honest.
And I'm just going to go very, very slowly.
And what Pam is doing here is she's actually placing the product very deeply. And this allows the maximum use of the calcium hydroxyapatite to lift and volumize the area. So instead of filling the skin, she's actually lifting the tissue up from underneath.
Excellent.
How you doing?
Great.
I don't know, you seem cool
You're
as a
amazing.
cucumber.
Wow.
And I'm going to go just right below that. Again, a little pinch.
So we're still in that same area?
We're still in that same area. We can call it deep volumizing, or we can say it's in a pre-periosteal location. This is an area sort of just above the bone and below the muscle and the skin in this area. It's also a very safe area to inject. There's not much in the neighborhood down there.
Excellent.
And so that that will provide a good long-lasting correction. This area doesn't really move very much, and the less it moves, the longer a product lasts.
Good to know. That's good for you, Terry.
Absolutely.
Still doing okay, Terry?
Yeah, the crackling I hear a little bit, but
That's very normal.
We sometimes refer to that as the snap, crackle, pop.
Snap,
You have
crackle,
injections into this area. Give me the.
But in this case, that's a good,
a good thing,
sound.
right?
Yeah, exactly.
So one of the advantages of volumizing is that it directly addresses the shape change that comes with aging. And we all lose volume as we age. Some of it lose it faster in some areas of the body. People who are lean and athletic tend to notice it more. People that are heavier notice it less. Sometimes we talk about how Winston Churchill or Alfred Hitchcock didn't have many facial wrinkles.
No.
Simply because they had a lot of facial fat.
No, it's kind of, you know, we all want to take care of our bodies and you work on being very toned and fit, but then at the same time you're like, but my face. So it's great to know that you can have both.
Absolutely.
Yeah.
And there was a French actress that you may have heard of by the name of Catherine Deneuve.
Oh, yes.
And do you know her quote on her 40th birthday?
No, share with me.
The quote was, on turning 40, a woman has to make a decision to save her face or her ass. And her comment was very apropos because it talked about how if you gained weight, your face would stay filled out.
Yes.
But if you exercised and kept your rear end in shape, then your face would show your age, and you were really stuck between a rock and a hard place. In a poll that was done on Lemon Drop, how many people do you think, what percentage, decided that they would save their face over their backside?
I'm going to go 65 face.
Oh, you're very good. You're very good. It was just a little higher. It was 74% face.
That's not
And what
bad.
does that tell us? It tells us about the importance that people place on their facial appearance. So when we say facial aesthetics and facial injectables, I mean really that's the home base of all of these rejuvenation procedures. It starts there and then you move along.
It's true, the face is the first thing that you really look at on someone. So it's extremely important. It's the face.
It is. It's where you make your decision about how attractive they, even babies react differently to attractive and unattractive
They
faces.
do, yeah.
And about how old someone is, about whether you can trust them, and it's all in the face. So while the body is also very, very important, it all begins up on top.
How are you doing, Terry?
Great.
Wow,
Yeah, it
that
was
looks
amazing.
fantastic, Pam. I see lots of inflation in that area, and maybe just for the benefit of the camera, Terry, I'm going to roll you slightly back and forth, and we can take a look at the hollowing present on the left, which has not yet been treated, and the nice, really, you've gone from concave
Wow.
anatomy to really slightly convex here, which is a
You look
much
great,
younger
Terry.
look. So very, very nice work, Pam.
Thank you.
Now we're going to move down to the lower face. And in this area where Terry has this hollowing here, what we want to do is we want to put some volume in there, but obviously we don't have a lot of bone there because that's on the outside and the inside is his cheek. So our technique is a little bit different here. We'll actually be doing what we refer to as a threading or a fanning technique and be placing small amounts of the product in thin layers.
Okay.
And it's a little bit like stacking Lincoln logs. And what happens is those layers, as they cross, provide a structural rigidity and a structural framework. And remember, we're going to be growing new collagen.
So how is the sensation different in this part of your face?
It's pretty similar.
Pretty
actually.
similar?
Yeah, just
Okay.
the same nothing.
The
Little
same
pinch?
nothing.
Just a little.
He'll be in the
Oh, I
chair,
feel
I'm
a
ready. If I can experience what Terry's experiencing, I love it.
Well, and you know, Stuart, that brings up a really good point because many people who've never had facial injectables are afraid of the needle.
You're scared.
Needle phobia. And once they experience it, by far, the most common comment is, wow, I barely felt that. With our techniques today, with our topical anesthetics, our anesthetics that are mixed with the products, super tiny, super sharp needles, and actually even a needle that doesn't have a tip on it, called a blunt tip cannula.
Okay.
With those products and those techniques, we could make it a virtually painless procedure. We reduce the risks of
Excellent.
bruising and which is the most common side effect of an injectable.
So is there anything, you know, we'll talk about post-procedure, but anything that you should know before you decide to come in and sit in the chair? A couple things you should do the days before, or are you good to just show up and you're ready?
That's a great question, Stuart. One of the most important things is that if you take aspirin electively, and a lot of people do,
Yes.
ideally for about 2 weeks before your procedure, you'd stop aspirin and any other blood thinners that you take because it really increases your risk of bleeding and bruising, which doesn't make it a bad outcome, but it certainly makes it a lot more noticeable to your friends and coworkers.
We don't want anyone to know.
Right, it's our little secret.
Exactly.
If you are medically prescribed aspirin by your doctor, then you should check with your doctor before stopping. You can still do injectables with patients who are on blood thinners, but again, the risk is they may have a little bit more bruising.
Okay.
Correct. And if there's any active infection in the area, you don't want to be injecting through an infection. So those are just some basics.
Good to
Make
know.
sure that the skin is properly prepped, and really afterwards with most of these products, there's no specific or special care that's required. It really is sort of a, as we sometimes say, a plug and play approach. Come in, get your treatment, you can go to lunch, you can go to the gym, you can go to the spa, you can pretty much do anything you'd like.
So talk to me about, with this treatment specifically, the volumizer, when is he going to see the results?
That's a great question. Well, the answer to that is right now. It's immediate. One of the beautiful things about calcium hydroxylapatite, which is the volumizing filler that we're using, is that the product is really two products put together. And the first half of that product, which we refer to as a CMC gel, that provides immediate volumization. And the other product that's in the mix, the calcium hydroxylapatite, it actually acts to stimulate the growth of your own natural collagen. But you don't have to wait for that. So you have an immediate correction, and then you have a slow-growing natural collagen correction. And the beauty of that is it gives you a long-lasting and natural result. So when Terry gets off the table, he may be a little red and swollen from all the rubbing and the alcohol scrubbing and everything else.
Yeah, usual.
But he's going to have immediate correction.
And then what about optimal results? When is he going to look the best for this?
Well, we always say with any injectable that things always calm down by 2 weeks.
2 weeks.
And that is that you can have a little bruising and a little swelling, and it takes just a little time for the skin to heal. And at 2 weeks, what you should see is you should see the result that should be a durable result. I would guess that Terry will see improvement in the temporal area for 1 to 2 years.
Wow.
Long time.
That's fantastic.
Remember, not much movement up here.
Yes.
And down around the mouth and the lower cheek area where there's more dynamic tension, movement with smiles and laughter and chewing and drinking and whistling
Usual
and
people stuff.
yelling on the soccer field
Yes.
and things like that. I think he can honestly expect a 9 to 15 month duration, and that's a long time. And he'll have the opportunity at any time to come back and have a little bit more done, have sort of a booster if he would like, and he can maintain that effect. Or if Terry should decide, he can let it fade away and start over again. But most people don't want to do that.
No. Okay, Terry, so we need to plan your photo shoot for in 2 weeks, okay?
Absolutely, you got it.
Your new profile pics for all your social media campaigns, right? I love it.
Well, Pam, I have to say that really looks fantastic. You've done a fabulous job. Terry is just looking terrific. And I think that it looks very natural. That's the most important thing. And I don't see any bruising. It's normal to have just a little bit of bleeding from the needle, but that quickly stops. All right, Terry, and for the benefit of the camera and the audience, what I'm going to do is I'm going to roll you back and forth like this a little bit. And I want to point out specifically how hollow we are in the temple here and in the lower mid-face here. And then I want to roll you back this way. This is your good side for the camera now. And you can see the volumization through the temple and this volumization through the mid-lower face. Really a nice result. Really nice, very nice injections there, Pam. And Terry, just one more time, the level of discomfort?
Hardly any. Pam's amazing. I mean, you didn't see me flinch, so.
No.
Yeah. So
was amazing.
mosquito bite, something like that?
Just a little sting here and there, but that's it.
Excellent,
Yeah,
excellent.
That's great to know.
Well, that looks fabulous.
Well, Terry, I have to say I'm so excited for you. You look incredible, and I can see that this really works.
Yes.
Excellent. Well, thank you so much to Pam and Dr. Werschler. For Aesthetic TV, I'm Stuart Brazel. Stay tuned.
And stay beautiful.